questions here real quick. So we got here, it says 72 years old woman presented in the emergency department complaining with left pain, left 3 months, most pain. She knows recall trauma rate. She described pain as sharp and progressively reacting down posterior left thigh and left knee. She's no smoker and a history of anticoagulant therapy. His past medical is for peripheral vascular disease, hypertension, and hyperlipidemia. The physical examination focusing on left gluteal region revealed atrophy and muscular weakness. The blood cell count and blood chemistry profile are normal. The suspected embolus was confirmed with the pelvic computer tomography scan demonstrating heterogeneity in the housing blockage in the deep range of the superior gluteal artery. The patients underwent an uneventful super-selective embolization and recovered well. Complete occlusion of this artery may cause muscle ischemia and atrophy that would compromise the ability to perform which of the following actions. So she have a block. She have an embolus in the superior gluteal artery. So complication of that muscle what will compromise ability to perform which of the following. So let's see. Walking, climbing stairs, standing, running. I think walking. Let's see, walking. Exactly, walking. So you can pause the video and read the explanation. We are timing. Let me show you guys. Let me show you. This is time it. The time is running, so you have to go fast. Next. Let's go to the next. So I usually read down here first, and then you have an idea what they are gonna ask you. So which of the following additional findings would most likely see in this patient? Which of the following additional findings would likely see in this patient? Prosopagnosia, organ syndrome, profound lower. Okay. All well healthy 85 woman presented left side weakness. Her symptoms started 4 hours ago while she was on the phone with her niece. If you recall dropping the phone and being able to pick it up in her left hand was no significant medical history, no medication, physical symptoms, decreased sensation of the left side, which is worse in the left side of the face and upper extremity. The patient was diagnosed with weakness of the left upper extremity, as well as a weakness when dropping the lower half of the left side of the face. Ophthalmologic examination revealed conjugal age deviation to the right. No contrast computer tomography scan of the head is unremarkable. The patient started on aspirin. A contrast CT scan of the head few days later revealed an ischemic stroke involving the lateral convexity of the right cerebellar hemisphere. Okay, which of the following which of the following additional finding? So I don't think this patient is having. Yeah, I think it's Horner syndrome. No, it's just definitely this is no. Prosopagnosia could be profound lower limb weakness. Amaurosis fugax. I think it's Horner syndrome. Let's see. And the answer is monomus hemianopsia. The one I thought wasn't. So you can pause the video. You can read the explanation. Let's keep going. It's a long explanation. Keep going. So this guy, the rash does not appear to cross the patient's midline. A picture of the skin lesion shown below, which of the following best describe this rash. So this is obviously herpes. Which of the following best describe this phrase? Peripheral papilla space distribution. Over the peripheral scale or sedative representation. Vesicles in the dermatological distribution. Dermatomal, yeah. Yeah, vesicles in the dermatomal distribution. Vesicles in the dermatomal distribution. This is Alper zoster or shingles. You can pause the video if you want to read more. That explain the history of what is. We keep the virus for a long time in the ganglion, and appear long time in a long time. Long time later when you are adults, appear again. So you can read it. Next one. Let me take a picture of this one here. Okay, let's keep going. Which of the following corticosteroid related adverse effect is most likely? Which of the following corticosteroid related adverse effect is most likely? Corticosteroid therapy a few years about symptoms, appears and complication. Okay, so this is 8 years old. He got asthma, he been whistling, coughing, position doesn't appear. I think it's just short stature, or I think it is. Oh god, I was confused. That hoarseness of the voice. So this is the answer. The most common side effects associated with the inhaled corticosteroid is oropharyngeal candidiasis and hoarseness. Who learned that? Because I also was short stature. Okay. Next. Which of the following best describe the mechanism of action of this drug in the treatment of this patient condition? Which of the following best describe the mechanism of action of this drug in the treatment of this patient's condition? So they give him severe eye pain, blurry vision, visual acuity, cloudy cornea. Timolol is administered. This is to lower down the blood pressure in the eye. This patient's symptoms, which will find the best describe the mechanism of action. So timolol decreases production of chromosome, increase the levels of bicarbonate of truth. That's so good for me. Delayed opening of travel. I don't know. It increases transit chromosome in the clone. No, suppress the ciliary production. Increase outflow. Increase the outflow of the bilateral. Okay, I think it's this one or this one or this one. It's decrease the production. No, it's this one. Suppress the ciliary epithelium from producing more aquosus. Aqueous humor. Yeah. Timolol's beta blocker used to treatment in glaucoma. Okay. Next. Inhibitor production or conjugal injection or insecticide during the attack. What is the mechanism of action of the drug that will best treat this patient condition? Okay, patient presents the alternate patient complaint of right side jaw pain. Complaint of right jaw pain. Multiple experiencing symptoms 2 or 3 times a day, which appears to be last about 30 seconds. Okay, this is think this is sodium influx. Oh, prevent sodium influx. Okay. So the patient was trigeminal neuralgia, trigeminal neuralgia pain. For this carbamazepine is the drug of choice. Recommending blocking sodium channel. Okay, you can pause the video if you want to read it. Keep going. So the patient has a negative blood count and her husband positive group. Which of the following should be administered immediately in these patients to prevent potential serious complication during delivery? I think you know this, but let's see. Yeah, this one because it's